All right, so now we do part 2 of Cardiovascular, Chapter 9, Week 3. So we talk about angina pectoris, which is chest pain, implications for the PTA. Symptoms of angina pectoris may be confused with heartburn, triggers in the left pectoralis muscle, anterior chest wall syndrome with localized tenderness of the intercostal muscles, Tietze syndromes with inflammation of the costochondral junctions, intercostal neuritis. So these are all things that can be confused. Now, Tietze syndromes is funny because you get these little micro tears that can occur at the costochondral junction. Usually happens in 20, 30s, under the age of 40. Sometimes if you do a lot of weightlifting, you like to bounce the bar off your chest, you can get little micro traumas there. So you have to be careful. Now, patient reported chest pain should be reported immediately to the supervising PT, who may notify EMS, as treatment of a heart attack within 60 to 70 minutes can make a significant difference in outcome. So if anytime your patient says they have heart or chest pain, you don't take that lightly. You have them sit down and you tell your supervising PT and call EMS. When in doubt, you call 911. Because if you just say, oh, it's just heartburn, or if it's just, it'll pass, that's your license on the line. So be extra cautious anytime a patient, especially if they have all the comorbidities and they complain of chest pain. Okay. Patient with angina should reduce pace or stop all activity, sit down until the symptoms disappear. Some patients with a history of angina pectoris are prescribed nitroglycerin by their physician. Typically, pill is placed sublingually or under the tongue. In some cases, to be taken prophylactically 5 minutes before activities that are likely to precipitate angina. For anginal pain not relieved by rest or up to 3 nitroglycerin doses in 10 to 15 minutes, the physician should be contacted. And of course, monitor vital signs. So let's say you're working with a patient and they have chest pain and they have nitro. Well, you have them take it and then see. And they're like 5 minutes later, they're like, oh, still have a little bit of chest pain. Have them take another dose. Okay. And they're like, oh, it's feeling better. Then you're good to go. But if you're in doubt, still call 911 and still call the physician just to make sure and tell your supervising PT. Okay. But those are the first actions. You don't want to have them sit down and not take the nitro while you're trying to scramble and figure out what to do. Have them take that nitro first and see what happens. Okay. Nitrate agents, they decrease ischemia through smooth muscle relaxation and dilation of the peripheral vessels. So that's how it works. Most commonly used is nitroglycerin and nitrostat. Indications: angina. Implications for the PTA: educate patients to come to standing position slowly to decrease potential orthostatic hypotension. Because your arteries and veins will vasodilate, your blood pressure will drop. Okay, so if it drops, then if you get up too quickly, down you go, and you're going to faint. Now, here's a good slide that you should know the normative blood pressure values for adults. Normal is less than, not 120 over 80, but less than 120 over 80. Prehypertension is 120 over through 139 systolic and 80 to 89 diastolic. Stage 1 hypertension is 140 to 159 and over 90 over 99. So 140 over 90 to 150 over 199 is stage 1. Stage 2 is greater than 160 over 100. Normal heart rates 60 to 100. Yeah, some of you little rabbit hearts, boom, 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 boom. Every time you take a clinical or you have to take a quiz, you get a little heart rate. That's normal. So bradycardia, less than 60 beats per minute, and tachycardia is greater than 100 beats per minute. Hypertension, which is high blood pressure. What are some implications for the PTA? As a sudden increase in blood pressure can occur with any increase in intra-abdominal pressure during exercise or stabilization exercise, which can be dangerous for already hypertensive patients, such as the Valsalva maneuver. So that's where you hold your breath and you bear down, so you got to be careful. The PTA must alert and educate those individuals with hypertension about this and teach proper breathing techniques during all activities, because a lot of patients have a tendency to hold their breath and bear down, especially when they're lifting weights or doing exercises, and you need to tell them you don't do that and make sure that they don't bear down, because if they have a high blood pressure, if they do the Valsalva, their blood pressure will increase even more. Diuretic agents increase the excretion of sodium and urine, reduces plasma volume, which decrease blood pressure. Most commonly used diuretic agents are thiazide, angiotensin converting enzyme, which is ACE, potassium sparing agents, Lasix, diuretic. Why would they take that? Hypertension or CHF, congestive heart failure. Implications for the PTA. Need to avoid sudden changes in posture due to potential dizziness and fainting from hypotension. Patients with heart failure should avoid rapid increase in physical activity. So if you look at disease pathology so far, we've always done what? Whether it's fibromyalgia, systemic lupus, now going into cardiovascular. Listen to your patient, monitor vitals, go slowly, always be in constant communication with your patient, and you should be fine, right? So those are things. It's when you get into trouble, is like you just go through your routine and you're like, okay, got my 9:30, I'm going to walk them, do that, and you don't pay attention to all these other signs and symptoms. That's when you're going to run into trouble. Seems like common sense, but when you get in the thick of things, people do still make these mistakes, and you're thinking, how is that? Well, remember, not everyone is textbook. They're going to have all sorts of things. Someone's going to cry on you. Someone's going to lash out at you. There's all these things that you have to be prepared for, and sometimes with that stress, we forget to the simple stuff, such as monitoring vitals, etc., etc. Beta blockers decrease the myocardial oxygen demand by decreasing the heart rate and contractility by blocking beta androgen receptors. Thernormin, Lopressor, Inderol. Indications: hypertension, angina, heart failure. If they're on beta blockers, decrease heart rate and blood pressure in response to exercise. You should always monitor the patients for orthostatic hypotension and go by rate of perceived exertion. Calcium channel blockers decrease the entry of calcium into the vascular smooth muscles, resulting in decreased myocardial contraction, vasodilation, and oxygen demand for the heart. Most commonly used is Cardizem, Norvasc, and Procardia. Why would they use calcium channel blockers? Very similar to beta blockers. It's for hypertension, angina, but you can also use them for arrhythmias, congestive heart failure. You as a PTA, decrease heart rate and blood pressure in response to the exercise, so you must monitor patients for orthostatic hypotension during positional changes. So if they've been lying down supine for a while and you get them to sit there for 2 minutes, have them pump their ankles, get the blood going, versus, oh, hurry up, go, it's a 9:35 already and I'm running late, and you'll be even later because that patient's going to pass out on you if you rush, so be careful. Why should we exercise? Regular program of aerobic exercise facilitates cardiovascular conditioning, may assist in weight reduction, may provide some benefit in reducing blood pressure. Heavy isometrics or heavy weightlifting may be harmful because blood pressure often rises because of the vasovagal reflexes. Vital signs should be monitored pre, during, and post-exercise by the treating physical therapy assistant. What about arterial hypertension? Arterial hypertension is a measure of force of blood against the arterial walls. Now make sure you know the difference between the arteries and veins. Remember, arteries carry oxygen-rich blood to the body, where veins return oxygen-poor blood. In healthy adults, the highest pressure, called the systolic pressure, should be less than 120, and the lowest pressure, called diastolic pressure, should be less than 80. So normally blood pressure varies throughout the day with activity. Hypertension is defined as an arterial blood pressure of 140/90, greater than, in adults on at least 3 consecutive measures. Treatment for arterial hypertension: weight loss, cardiovascular exercise, reduction in salt intake, medications to reduce BP. All right, now pulmonary arterial hypertension. So we first talked about arterial hypertension, but this is pulmonary arterial hypertension, a condition of high blood pressure in your pulmonary arteries, lungs. Average normal pressure in pulmonary artery is 14 milligrams of mercury at rest. Pulmonary arterial hypertension greater than 25 milligrams of mercury at rest and greater than 30 milligrams of mercury during exercise. Okay. Signs and symptoms: dyspnea, shortness of breath, syncope, loss of consciousness, or fainting. As disease advances, the pumping ability of the heart weakens and the symptoms occur at rest. Okay. Now, how do you treat pulmonary arterial hypertension? Treatment: without treatment, prognosis is poor, with median survival rate of less than 3 years. Severe symptoms require a severe aggressive treatment to remove underlying cause, reduce symptoms, and improve quality of life. Medications, oxygen, and lung transplantation sometimes. Now, myocardial infarction, that's a heart attack. That's total occlusion right there. So as a PTA, let's say somebody's had a heart attack. What are your considerations? What do you have to be careful with? So post-MI consideration: if the patient has been given analgesic medication, like a painkiller, the pain response may be masked, making it possible for the patient to overexert themselves. So you have to be careful that if they're on pain medications, we don't want to overdo it with the exercises. Early therapeutic exercise helps prevent cardiopulmonary complications, venous stasis, joint stiffness, and muscle weakness. Relaxation often promoted with low-intensity activity. Avoid activities that increase intra-abdominal or intrathoracic pressure, such as sit-ups or the Valsalva maneuver. I'm not a big fan of sit-ups anyway. If you're having your patient that's post-MI doing sit-ups, we need to chat. Okay, so there are some things that we want to make sure that we pay attention to. Again, post-MI considerations: monitor vitals throughout. Monitor heart rate, BP, oxygen saturation. PTA should use the rate of perceived exertion, RPE, with patients on certain medication and those with obesity. All right. So let's stop there.